I know, growing up, everyone has seen those ads with a beautiful, tan, young adult walking down the shore of the beach. Likewise, I know you've all seen the opposite. An older individual whose skin appears to be leathery and extremely wrinkled for their age. In most cases, both of these appearances are results of excessive use of a tanning bed. Some effects are noticeable, which are generally negative and lifelong. While others are not so noticeable and also lifelong, they can be more beneficial, such as medical benefits. Just a few negative effects which result from the use of tanning beds include severe sunburns and self-esteem issues, which are closely related to the use of a tanning bed in young adults. Severe sunburns can result from the excessive use of a tanning bed prior to any recent sun exposure, according to the Sun Teacher written in 2010. Many young adults have mental self-esteem issues, which are closely related with the use of a tanning bed. These self-esteem issues can include being highly concerned about their weight, which leads to binge drinking and using recreational drugs to aid in weight loss. These can cause many other long-term health risks in young adults, according to Cancer Causes and Control in 2008. If no eye protection is worn over a long period of time, then an individual can acquire eye damage from the strong ultraviolet rays your eyes are exposed to, according to the Science Teacher written in 2010. Along with eye damage, an individual can acquire noticeable signs of premature aging. These signs can be wrinkling or baggy eyes for their young age. Prolonged excessive use of a tanning bed can result in skin cancer. If left untreated, this can be fatal, according to the Science Teacher written in 2010. Some results are not so negative and can be more beneficial to an individual. Some positive effects found in 2004, according to the American Journal of Clinical Nutrition, state that tanning beds aid in getting an optimal level of vitamin D within the skin. They also stated that the use of a tanning bed correlated positively with bone mineral density. One other very beneficial use of a tanning bed is phototherapy. Phototherapy is highly effective in the therapy of psoriasis. According to the Journal of Investigative Dermatology, after a 6-week study with 20 individuals, there was a huge decrease in side effects noticed in many of the individuals. This confirms that is an effective treatment of psoriasis. Tanning beds can be beneficial to one who uses them correctly, not excessively. Excessive use would consist of daily exposure, whereas the recommended exposure is twice a week, according to the Photodermatology, Photoimmunology, and Photomedicine, written in 2006. Using a tanning bed twice a week, with increased exposure times during each use, will yield a noticeable result. An individual does not have to go to a tanning bed every day to yield a noticeable result. When someone thinks of tanning beds, they usually relate it with getting a nice glossy tan. This is an effect of a tanning bed. Other effects that are sometimes forgotten are beneficial to individuals and they can medically benefit.